Hi everyone, welcome back to Television Chronicle. Do you know that some people live with diabetes for years, feeling completely fine, until one day their vision becomes blurry or filled with patches? That is the reality of diabetic retinopathy, a condition many people do not see coming. But today, we are going to break it down together. We will show you how it starts, what signs to watch out for, and how to protect your sight. So make sure to like, subscribe, and stay with us to the end of this video. You do not want to miss it, right? What is diabetes? This is a disease that occurs when your blood glucose, also called blood sugar, is too high. Glucose is your body's main source of energy. Your body can make glucose, but glucose also comes from the food you eat. We have what we call insulin. It's a hormone made by the pancreas that helps the glucose get into your cell to be used for energy. We have types of diabetes: the type 1 diabetes and type 2 diabetes. The type 1 diabetes, your body makes little or no insulin. Your immune system attacks and destroys the cells in our pancreas that makes insulin. While the type 2 diabetes, here the pancreas may be making insulin, but is not making enough insulin to keep your body glucose level in normal range. Now, let's move over to the business of the day. What is diabetic retinopathy? Diabetic retinopathy is a complication of diabetes caused by damage to small blood vessels that provide nourishment to the retina. It is the leading cause of blindness and vision loss in working-age adults. But do you know that someone can actually have diabetic retinopathy and not even know? In fact, most people in early stage have no idea it is happening because they feel fine and their vision is okay, but inward damage is actually happening. That is why it is called the silent thief of vision. So how do this actually happen? How does having diabetes in the body ends up causing damage inside the eye? Too much glucose in the blood acts like a toxin over time. It affects the walls of blood vessels over the body, including those in your eye. So in the eye, high sugar called hyperglycemia in uncontrolled diabetes mellitus weakens the walls of the blood vessel in the retina, causing them to become leaky. Small bulge called microaneurysm also forms, and this can leak fluid or blood into the retina. This disrupts how the retina receives oxygen and nutrients. In response to that, the eye tries to create a new blood vessel, but this new vessel are abnormal and fragile. They can bleed into the vitreous, causing floaters or even sudden vision loss. This is why diabetic retinopathy is a silent threat. It begins from a body-wide condition but ends up with damaging the center of sight. The question now is, who is at risk? Could it be you or someone you know? Who actually should be worried about getting diabetic retinopathy? Is it just people with uncontrolled diabetes? The answer is no. Not just that, anyone with 1. Longer duration of diabetes. 2. Poor blood sugar control. 3. Hypertension, when associated, may also increase the change of diabetic retinopathy. 4. High cholesterol. 5. Change in pregnancy, especially in diabetic women. 6. Smoking. 7. Kidney disease. 8. Type 1 or type 2 diabetes is at risk. So basically, it is not just about having diabetes, but also how well you manage it. The better the control of your sugar, blood pressure, cholesterol, the lower your risk. Let's move into the classifications of diabetic retinopathy. We have 1. Non-proliferative diabetic retinopathy, which can be mild, moderate, severe, or very severe. It is early stage where tiny blood vessels in the retina swell and leak, but no new blood vessels have been formed at this stage. The second one is proliferative diabetic retinopathy, an advanced stage where new weak blood vessels grow in the retina and can bleed or cause blindness. We also have the third one, diabetic maculopathy, a stage where diabetes damage the macula, causing blurred vision. We have the last one, the advanced diabetes eye disease. This is the final stage where bleeding, scar tissue, or retinal detachment can lead to total loss of vision. So, what are the symptoms of diabetic retinopathy? What should someone look out for? The tricky part is, in the early stage, there may not be symptoms at all, but as the condition gets worse, these symptoms can appear as blur or distorted vision, floaters, difficult seeing at night, dark or empty areas in the vision, sudden loss of vision. How can this diabetic retinopathy be diagnosed? The only way to know for sure is through a comprehensive eye exam, especially if the person has diabetes. Here are most common ways to check for diabetes. Number 1, urine examination. 2, blood sugar estimation. 3, renal function test. 4, lipid profile. 5, fluorescein angiography. 6, optical coherence tomography, that's OCT scan. And the last one, the fundus photography. So diabetic retinopathy is diagnosed through a painless eye examination to check for hidden damage. If someone is diagnosed with diabetic retinopathy, what next? Can it be treated? If the condition is mild, we usually just monitor it closely. The most important step is tight control of blood sugar, blood pressure, and cholesterol to prevent it from worsening. When the retina starts leaking or new vessels form, we may use one or more of these treatments. 1, antivascular endothelial growth factor injection to help shrink abnormal vessels and reduce fluid buildup in the retina. 2, photocoagulation to stop the leaks and prevent new ones from forming. 3, vitrectomy surgery to remove the blood and repair the detached retina. Even after treatment, the patient needs regular eye checkup to monitor the new changes. And managing diabetes well is still the most powerful medicine. Can diabetic retinopathy be prevented? After everything we have heard, is there any way to prevent diabetic retinopathy? The answer is yes. While we can't always stop it completely, we can definitely delay it, slow it down, or even prevent it in many cases. Here is what anyone with diabetes should do. Number 1, control blood sugar. 2, manage blood pressure and cholesterol. 3, having regular eye exams, even if you have no symptoms, at least once in a year. 4, quit smoking. 5, follow your medication plan. 6, stay physically active. And this is because exercise helps your body use insulin better and lower your sugar. So basically, it's about taking diabetes seriously. Even when your vision still remains okay, prevention starts before symptoms appear. Regular eye care and sugar control are the best gifts you can give your eyes. I hope this helps someone watching today. Diabetic retinopathy is serious, but with the right steps, it's not a death sentence for your sight. Thank you so much for watching. If you found this video helpful, don't forget to give it a thumb up. And if you care about your eyes or know someone with diabetes, please share this video. It might just save your life. Subscribe to Clear Vision Chronicle and hit the bell icon so you never miss our next video on eye health and vision care. Until the next time, keep your vision clear. Bye.